I'm going to start out with really talking about some of the assumptions that we make about colon cancer and about cancer in general. So first of all, we need to remember that colon cancer is not the same for every person. There are many variations in its presentation, treatments, and outcomes, and that colon cancer, like other cancers, comes with a measure of uncertainty associated with it. And it really can change a person's life as they know it, both physically, mentally, and spiritually. Everything presented today may not apply to every person, but you can sort of evaluate it yourself and decide what to adapt, what to accept, what to reject. I want to start with kind of a definition of, I think, something that's important when we're talking about this topic, which is optimizing wellness. And if we look it up in the dictionary, we find that optimize means to make as perfect, effective, or functional as possible, or to make the most of. And I think the second part of that is really important. And wellness, the quality or state of being in good health, especially as an actively sought goal, the condition of good physical and mental health. So when we talk about integrative medicine, we often talk about optimizing wellness and making the most of, and a process of actively seeking goals. So as a psychologist, I'm going to talk a little bit more about the mind-body part of it. And I just want to review and have us keep in mind that we recognize that there really are all kinds of reactions to both the diagnosis and to the experience of having colon cancer, from feelings of shock and disbelief, anger, depression, concern about the future, sometimes sense of loss and sadness often goes along with this. There are other things like increased levels of stress, and I'm going to talk a little bit more about stress, difficulty sleeping, cognitive impairment that can be a result of both the cancer and the psychological reactions as well as the treatment. Sometimes a diminished enjoyment in life or in one's ability to participate in social activities that once gave life a great deal of meaning. Sometimes we can find ourselves living in the future rather than in the present. And these are all important to note because of the changes that exist. Cancer can also disrupt, I think, the major areas of what I think are areas of life functioning. So we know that there are disruptions in physical functioning when colon cancer comes about, and certainly those increase as the treatment burden increases. But there's also increases in changes sometimes in one's social network, both in terms of having higher interest from people and sometimes people who don't understand what you're going through. There can be changes in sexual or reproductive health. There can be changes in work status, and that can affect one's finances and what one is able to do, and even worries about the future. And sometimes these changes are things that happen immediately, and sometimes they're things that happen at a later point in time. And of course, cancer being an illness that can be life-threatening, it also raises existential and spiritual concerns. And we have to be kind of aware of those sorts of things and how do we make meaning. So I've named this first sentence that I'm about to describe as a law, a Coscarelli Law, if you will be so willing to consider. And that is that for every physical effect, there is an equal reactive psychological effect. And I think in many ways that seems kind of simple, and yet at the same time, I think often it's something that's forgotten in the medical environment, where we talk about the medical things and the physical impact of things like treatment, like the loss of a bodily function or functioning the way that it used to, and not realizing what the psychological consequences are of that. And I think really an integrative medicine approach considers all of that and looks at that psychological, which really comes down to our second law, which is that the treatment of physical conditions must also include treatment of the psychological effects. The mind and body are inextricably linked. And I really want to underscore that. And I think it's important for all sorts of healing purposes. And so one of my first recommendations to any patients that I meet with is that they need to develop an integrated plan. And there are many components to an integrated plan, and I'm going to be talking about many of these, and then Dr. Hardy's going to be talking about some of those like nutrition and those sorts of things. But there really needs to be tools in your toolbox for managing psychological distress. There needs to be a specific plan for a very common experience, which is fear of recurrence. There needs to be plans to maximize opportunities for post-traumatic growth, and I'll say a little bit more about that in a few minutes as well. So it's really important that we look at all these things and try to develop that a plan. Now, what are the components of that plan? Well, the components of a plan around psychological distress is to look at both professionally based things as well as psychoeducational and skills based. And on a certain level, all of you who are on this call today, I'm preaching to the choir in the sense that you're here because you're out to get psychoeducational information that's going to help you in some way to better cope with and live with this illness. But keep in mind that there are many, many things that can come, both in terms of individual counseling, family support, couple help, sometimes psychotropic medication, that there are mind-body techniques that one can learn, as well as groups and peer support. And all of those things should be part of and integrated into your plan. I'm going to spend a few minutes talking about stress. And the reason that I want to talk about stress is because I think stress is a really big part of cancer. When you're diagnosed with cancer, it's probably one of the most significant feelings that people feel. Life was already complicated. Now it becomes more complicated. And the thing about stress, and both stress and anxiety, they become imprinted on us. They become imprinted on our brain, both in our mind and in our body, because, in fact, the cancer diagnosis is what I would call an extreme traumatic stressor for people. And it's not just for the patient, but it's for the families who also get the diagnosis as well. What happens is, in that initial diagnosis, we have an activation of what many people understand is to be the fight or flight response. And that's a very great response. It's an instinctive response, an evolutionary response that, in fact, is why we're all here today, because our ancestors long ago had this fight or flight response, which allowed us to flee or to fight in situations and really to preserve our well-being. It's a whole systems response to an immediate threat. And we have this lovely system called the sympathetic nervous system, which is what gets activated in the fight or flight response. And so our heart races and our muscles tighten, our pupils dilate, and we have shallow breathing, and the flow is directed to the heart. We're ready for action, and lots of hormones power up in our systems. And it's a great and necessary system. The other part about it is our body has a way of downregulating that, and we can create an automatic relaxation response, and that's caused by the parasympathetic nervous system. So all those things that got revved up and charged and going can slow down again when the parasympathetic nervous system gets activated and the heart slows, the muscles loosen, and it's kind of that great feeling of being able to relax a little bit. The difficulty or the challenge in colon cancer is that, our slides are moving a little faster here. Okay, so the difficulty is that the thing about the stress is that initially it comes on very strong, but over time it can become sort of an ongoing part of life. And the question is, what happens when that stress becomes sort of more ongoing and it's added on to the normal difficulties? And how do you manage something when it's more subtle and maybe more difficult? When you have that sense of threat or danger or stress, but it's no longer immediate, it's not imminent, it doesn't necessarily pass, and it becomes chronic. And we do not have an automatic relaxation response to combat that. So one of the keys to managing stress is to develop some techniques to actually be able to do that. And the mind and body are intimately connected. And thoughts influence the body, and the body influences the mind. And there's this wonderful feedback system that happens both in a positive and a negative way. But our thinking brains can really exacerbate stress and anxiety, but it can also be used to calm anxiety and stress. So the real goal is to harness our healing resources to help us learn how to self-soothe once that immediate danger is gone, but there seems to be the chronic stresses associated with the illness and managing the impact of it. Now, I like to talk about managing stress, not controlling stress. And the reason that I like to talk about that, because I think that's more doable. Control is a word that gets us in trouble. It's actually part of the problem. And it's sometimes something we really can't meet. So we have a myth about being able to control all kinds of things that are in reality outside of our control. So it may be a more useful way to think about how do we manage our well-being rather than controlling it. And I want to talk about some techniques that I think are really helpful and that I think everyone should know at least one, if not more than one, of these kinds of techniques that can bring about that relaxation response. And these are things that need to be practiced in non-stressful circumstances so that when the more stressful circumstances come about, that they can be handled. And one of the techniques that I think is particularly helpful are things related to breath and breathing. And a very simple exercise is what we call four-square breathing. And in fact, you can do it right now as we're talking about it. It's where the first step is you take a deep breath in for 4 seconds. So as you breathe in, it's 4 seconds. You hold it for 4 seconds. You slowly exhale it for 4 seconds. You then pause for 4 seconds, doing nothing, and then you repeat the process as many times as you need until you're able to calm down. There are other ways of bringing attention to your breath, or using a signal breath where you purse your lips and you blow out through your lips and you say the word relax in your mind that helps to signal this relaxation response. Diaphragmatic breathing, you may have heard about, is when you're it's often called belly breathing, because rather than breathing from your chest, you're actually, when you're breathing in, you'll see your belly rise. So those are some very important techniques that help calm down and reduce stress. Other kinds of techniques have to do with sort of using your conscious mind to actually to connect to that autonomic nervous system. It's actually a form of self-hypnosis. So it may be imagining a heaviness or allowing your hand to warm, and imagine the blood flowing into that and feeling that warmth. Another form of it is progressive muscle relaxation, where you do a tightening of your muscles and then a relaxing of your muscles. So, for example, if you did it with your fist, you might make a fist with your hand, hold the tension in it, hold it, let it build, and then all of a sudden let it go. And you can do that throughout all the muscle groups in your body. And all of those techniques can be helpful. Some people use guided imagery, finding a safe place or imagining a place in nature and visualizing it and really creating a safe place within themselves, using their breathing, thinking about that place that's so heavenly, as some of the pictures on my slides show. Imagining yourself there and breathing and being a part of nature can be another process that can help bring on that relaxation response. Now, another technique, which is not in sort of the relaxation mode, although people often get relaxed when they do this, is something called mindfulness or mindful awareness. And that's the process of moment-to-moment attention to a very present experience. And it's also with a stance of open curiosity. I like to think of it as the distinction between doing and being. And that's a really important way of thinking it. Sometimes we can get into a more mindful place by focusing on our breath. And in this particular idea, we're really using our thoughts, and we're harnessing them to bring our awareness and attention to a particular thing. And this is not necessarily closing your eyes and lying down and relaxing in the way that we do. That might be part of your practice sessions. But mindfulness can be something that's integrated in every part of your life. I think about it often as something someone can do even with one's cell phone. The cell phone rings. How many times do you just automatically pick it up and you answer it? But have you ever think about just slowly picking it up, thinking about how do I be really present for whoever I'm going to speak to on the telephone, and really focusing on just that activity alone? That's a kind of mindfulness, and that's the kind of thing that I'm talking about. And that can be really helpful in relieving some of the stress, distress, and suffering that goes along with a cancer diagnosis. Additional mind-body methods include things like Qigong, which is a form of sort of the healing arts form of Tai Chi, also yoga. All of these techniques can be really helpful in integrating the mind and body, bringing about relaxation, and sometimes increasing a sense of clarity for dealing with stressful kinds of things. Now, any part of a comprehensive plan that we might think about should also include symptom management. So that should be things like pain and sleep disruption, side effects of treatments. Those are important components, and those need to be integrated both in terms of your mind-body techniques, and some of the things we talked about already would be useful with some of these sorts of things. For example, sleep disruption. Some of the mind-body techniques that I've talked about can really be used to help with sleep, and sleep can really become disrupted from a variety of sources. It can become disrupted from pain, it can become disrupted from surgery, from treatments, from worry. So we encourage people to not only develop the mind-body techniques that I've talked about to use to help with that, but also to use what we call good sleep hygiene. Sleep hygiene is when you use your bedroom only and your bed only for sleeping. You avoid activating activities before you go to sleep. You have regular bed times and wake-up times, and you don't do stimulating substances. You exercise early in the day. You evaluate medications that can be disruptive to sleep. We really need sleep because sleep is restorative, and it's restorative both psychologically and physically. And a lot of times we need some CBT, some cognitive behavioral techniques that one can learn from a psychologist to help cope with the worry that sometimes goes along when we have difficulty sleeping. So I want to talk a little bit about some of the worries and the fears that come up associated with cancer. And one of the most common ongoing fears, whether one is in treatment or one is in survivorship, is this fear of recurrence or fear of progression of the disease. And that can come about from fears of aches and pains. It can come about whenever there are scans or test results to be learned. And certainly whenever there's media attention on cancer, it can kind of bring up those sense of worries. And that's something that we often need a plan to deal with. Often related to that fear of recurrence or progression is also sometimes what we call post-traumatic fear or stress associated with the medical environment. So seeing doctors, having scans, test procedures, sometimes returning to the location of the diagnosis or the treatment, and certainly anniversary dates that one was diagnosed or one started treatment. All of those things can sort of bring up this ongoing sense of fear. And that was some of that when we were talking about stress, that ongoing sort of subtle piece that can sort of re-enter one's life and be part of everyday existence, where we may need to apply some techniques to it. So the fear of recurrence, I think this quote is just really lovely in sort of describing, I think, part of what is the psychological experience for individuals dealing with a colon cancer diagnosis. Someone likened cancer to a pink elephant, and the pink elephant initially is right there in front of your face. And then as you get better, the pink elephant maybe goes to another room. And then as you get much better, the pink elephant goes down the street. But it's always there, and you always know it's there. And I think that as you approach appointments, the pink elephant down the street comes in the living room again. And I think that so aptly describes this process of how cancer moves from the foreground to the background for patients, and what that's like as it moves from the foreground to the background. And I think our goal is that even though it has to come into the foreground, we often want to then return it to the background as quickly as we can so that we can bring life and those things that provide the greatest amount of enjoyment in our lives into the present. And that's really how we optimize wellness in this process. If you notice the picture in front of you, this is a picture that was done by a patient in an art therapy program here at our center at UCLA. And that's one of the programs that we offer that we think is a really important part of some of the mind-body and healing processes that can happen for people. Just notice the things that you might see as you're looking at this, the rainbow, the blue sky, the flowers, the tree. And what the patient who did this tissue paper collage said, and this was in response to the question to illustrate how you're feeling today, life is good after completing treatment and the tree is strong, but there are still dark clouds hovering overhead and those annoying blackbirds. And I think that represents that fear of recurrence that can come about as a result of cancer. So one of the questions that I always ask is, does colon cancer really continue to exist? And the second part of that question is, does it exist in the body? And for many patients, they may have clean scans and may, really be in a place where they believe that everything looks good. But there's still sometimes those annoying blackbirds in their mind, that thinking about that possibility of fear. And then when that happens, colon cancer does still exist, only it exists in the mind. And part of a really good integrated plan actually deals with that fear of recurrence. And it's important to develop specific management strategies around how to cope with that fear of recurrence. So some of the things that I recommend, and I'm not going to go into great detail here today, but slides switched a little bit quickly. So one of the things that's important to keep in mind is that the strategies that one uses should include support from family and friends. So you can involve your family in helping you to manage that fear of recurrence. It's important to have a discussion with your physician about how to handle worrisome symptoms or concerns, aches and pains, how often to come in to the doctor, what kind of a time frame are you comfortable with? Both you and the doctor have to have some kind of comfort level with how long it would be before you come in for a checkup. And then there can be the development of cognitive coping strategies, things that you say to yourself that might help you to remember how many cancer survivors, for example, there's almost 12 million cancer survivors in the United States right now, or that your last scan was clean, or for right now, you don't have cancer. Using distraction can be very helpful, and even though we're all on the Internet today, on this webinar, I encourage you to avoid Internet surfing or random Internet surfing, because I think sometimes there are sites that just aren't that reliable, and it can actually exacerbate the level of anxiety and stress. So go to good, reliable sources like the Colon Cancer Awareness Alliance program that is offering this today to get that information. I want to talk just a little bit, I'm going to be ending very shortly, but I want to talk briefly about the plan for sort of how do we begin to optimize what's called post-traumatic growth. So we talk a little bit about post-traumatic stress, which is the stress that comes after the diagnosis and after you've usually gotten through treatment. But sometimes people actually can have something that's called post-traumatic growth, which is where you actually, in some ways, are better than you were before you ever had the cancer diagnosis. For some of you, you might talk about it as if cancer was a gift, that there was a certain kind of enlightenment that happened. You might have found greater meaning in your life, or you might have had enhanced or deepened relationships with friends and family. There might be some kind of more spiritual growth or an appreciation for your life, or as in the mindfulness, living in the present moment and appreciating that. So I think that there are opportunities to find that within this process. And some of that is by way of reducing the amount of stress, having mindfulness practices, having the kinds of support that you need in your life, and really connecting to those things that are meaningful. And I think that's very much integrated into this concept of your plan for both spiritual examination and how you handle and look at meaning in your life and how you transcend suffering. And those things, I think, can be important pieces of this. I want to mention that one of the pieces in sort of being able to do this is how you frame things for yourself. So how do you evaluate a situation? And I'm not just talking about whether you put on a positive, happy face and sort of have positive thinking about things. It's really more around the idea of being able to more accurately appraise things and appraise a situation in a way that helps you to feel like you can get through it, you can manage it, and that you're okay. And to lead you to a place of being less anxious or worried or overwhelmed. And one of the things that an example might be, I'm not what I used to be, but I can still enjoy, and you can fill in the blanks. For some people, they may say something like, I know that even if the cancer were to recur, I know that I'll be okay because I have inner resources. So sort of calling upon what you've learned from the experience that can help you to really move forward in your process. The last thing that I really want to talk about today is that we know that people who have multiple coping strategies and are flexible in their coping strategies overall tend to do better psychologically after a cancer diagnosis. So if you're really able to utilize some of these different kinds of things that I've talked about, individual counseling, medication, reframing, problem solving, relaxation, mindfulness, peer support, writing can be really a very powerful healing tool, art, and we're going to, Dr. Hardy is going to be speaking about wellness in just a minute. Again, pieces of this. If you can use some different coping strategies, you'll probably do better. And if you have the ability to move from one to another when one isn't working well for you, you'll also probably do better. So I really encourage people to think about that and maybe think about what are the strategies that you use. And are there any others that you might be able to add to your toolbox in dealing with this diagnosis so that you can live a well and happy and comfortable life with it? And I'm going to stop right now and allow Dr. Hardy to take over.
Thanks, Dr. Coscarelli. That was a really great way to begin this discussion, because if you haven't given yourself enough psychological room or space or enough internal support, it's going to be very difficult to make the good choices we're going to be talking about from here on. I'd also like to call your attention to the fact that if you have a question that pops up while I'm talking, you can go ahead and enter it in the question section on your screen now, too. Okay. So my interest in working with patients who have cancer grows out of my commitment to wellness and to being as well as you can possibly be, no matter where you are in a spectrum of health and disease. And for me, this has been an exciting journey because my patients were my first teachers, and they always remain, in some ways, the best teacher. We're going to think about things that on the surface things I know you do every day, you eat, for example. But we're going to talk together to give you a different way to think about these, to hold these, so that you can optimize lifestyle issues, dietary supplement choices, exercise, etc., to bring these into the service of your overall wellness. I like to think about you as if you're a garden. If you have not had cancer and you're in the prevention stage, then you want to make sure your garden has great soil, all the nutrition it needs, good drainage, elimination of toxins, lots of sun, so that you're in the business of making flowers, and they're gorgeous, healthy flowers. If you've had some weeds come invade your patch, how to get the weeds out in the least toxic way possible, and then again restart the idea of encouraging you to put down good roots and have good nutrition, or as some of you have heard probably before, having optimal terrain so that you're as cancer unfriendly as possible and the cancer has to work harder to come back. So that's what we're going to explore in the next 25 minutes. Like I said, you can be well throughout the spectrum of cancer prevention. You can be better as you try to do prevention. But even if you miss the opportunity to prevent an illness, there's symptom reduction of treatment that we can do, and reduction of toxicity of treatment. And then once you enter survivorship, then we're again back in the prevention mode, this time secondary prevention. So just keep thinking of this as a cycle in your mind that you keep iterating and doing and examining all the time. Now, I will say that when people first get the diagnosis of cancer, they're very upset, frightened, as Dr. Coscarelli has told you, and they start to make promises to God and everybody else, and they decide to change everything all at once. This may be difficult to sustain even in the best of times, and it may be especially difficult to sustain in the face of active treatment. So remember, perfection is the enemy of the good. Have a good diet. Nobody can be perfect, but you really want to strive in an honest way for a good diet. and that the stance that you take during active treatment is probably different than the stance you'll take when you're in survivorship and secondary prevention. Okay, so given what we're talking about today, what could you choose from? And the array of things that you can choose from is truly staggering, and it can even be paralyzing. It certainly can be overwhelming. Anything from all kinds of lifestyle issues, food, complementary therapies, medications or supplements, etc., herbs, you name it. And many of you have had the experience that someone always comes up to you after they know that you've had a diagnosis, and in great kindness, they want to offer you the best thing that worked best for them, for their neighbor, for somebody. So you're going to have a strategy to think your way through these things. Optimize the things that really we have evidence that will be helpful, or that they make you feel better, or both ideally, and then have a kind of a little bit of a Missouri, prove it kind of attitude when it comes to therapies that are a little bit more away from the norm, or that have a high cost or a risk of difficulty. Okay, and I think the deal is you get to choose. These are, I think, appropriate goals for a wellness plan. When people come to me and they do not want to do conventional treatment and they ask me to give them something that will, quote-unquote, cure them, I'm really straightforward, and I say that although there are lots of anecdotal stories, called case reports when they're in a journal, and called, personal stories when you hear them from somebody else, there are lots of anecdotal reports that suggest a dramatic response or an unusually good response, and that's fabulous, but it's not always so predictable. So I prefer the stance of both ends, blending the best of conventional treatment and then using a lot of the things we're going to talk about today to reduce risk, reduce toxicity, optimize therapy, reduce suffering, improve quality of life, etc. So these are the kind of things that you see on your screen that I think can be very helpful. And these do make a difference. They do make your quality of life better. Quality of life improves outcome. And it also, very importantly, takes you from being a passive, receptive patient to an active co-participant in your treatment plan. And I think that stance of being the person who's contributing and contributing really significantly to your plan makes a lot of difference in terms of feeling like you have some reasonable control, like everything's not just being done to you, things are being done with you, and that you have the right to assert what's true for you into your treatment planning and activity, and it really does make a difference to have a different way of looking at this. Now, there are some things that are general that would match a lot of different patients, but the best treatment plan, the best wellness plan, is one that's been tailored individually to you. You can get a lot of information from books and the internet, and our website has tons of great information, videos and all kinds of articles and stuff. And you can certainly use that to help you make some choices. But you also you want to have someone to sort of co-partner with you who can help you direct this. In an ideal world, it would be a person who is part of your oncology team, maybe a nutritionist, maybe someone who's trained like me as an internist. In a perfect world, it would be your oncologist. But you may have to search beyond that. And so when you find people to help you, make sure that they are that they're trained in what they're doing, that they have a good understanding of your medical condition, and that we talk a little bit more about safety. You'll see some other caveats. I would encourage you also to disclose what you're doing to your doing along with your treatment plan to your oncologist, so that oncologist can integrate what you're doing into your treatment plan, and perhaps caution you if there was some specific thing you're doing that might interfere with your current treatment. So this is the beginning of starting to talk about what some of these components might look like. Optimize your diet, exercise, maintain a healthy weight. And during treatment, this doesn't mean just lose weight. I don't like to see people, quote-unquote, diet. The old way that you used to say, oh, well, I got the food and I feel terrible, but at least I'll lose some weight. No, this is not the time to do that, because if you lose weight quickly during active treatment, the odds are very strong that you're going to be losing lean body weight and not fat. So we want you to neither get too thin, where you become really weak and hard to get around and do stuff. But if you were following a healthy diet and you lost a few pounds along the way, that would be fine. I think practicing regular stress management, not only for your quality of life, but also because if you're de-stressed, you make better choices. Go to all your follow-ups, use supplements appropriately, get the expert help, and I like to choose interventions from this arena that have scientific evidence where it's available. The evidence base for what kind of diet, for what kind of supplements, for what kind of effects is much smaller than it is for the chemotherapy medications you'll be offered. But there is a body of evidence, and it is growing. And when people are making recommendations for you in this area, they should be aware of this evidence, aware of these studies, and use them appropriately. This is a teeny-weeny little slide, which you guys can look at your leisure, but this is from the American Cancer Society. The American Cancer Society makes some very straightforward recommendations that they've made for many years. They talk about emphasizing healthy foods, 5 and more, and most of your protein to try to switch from animal-based protein to plant-based sources of protein. Eat 5 or more servings of a variety of vegetables and fruits each day. Whole grains, things that have a lot of fiber in them, in preference to refined sugars and grains. Limit consumptions of red meat. Maintain a healthful weight. Be physically active. And reduce alcohol consumption. So these major recommendations that are made broadly to all kinds of cancers, it turns out that that these seem very straightforward, and they're supported by a great deal of literature, and they are very, you'd hear the same, similar kind of references for other kinds of chronic diseases. But in fact, in a group of breast cancer patients, this study has not been done in colon cancer patients to my knowledge, but in a group of women with breast cancer, after diagnosis and treatment, only about 25% of them actually were following all 5 of the major recommendations. So it does take some attention to make yourself go through this list and constantly be thinking about, where am I on this one? How many vegetables and fruits am I eating? Can I get up? Can I move that up? How little red meat am I eating, etc. So this is sort of your roadmap for what basic things in diet to think about. And I'm going to go back 1 second for just a minute, because this, in colon cancer patients, people have about 2.5 of these risk factors really out of whack at the time of diagnosis. And one study that I've read suggests that if people were able to do fiber, decrease calories from fat, decrease red meat, decrease processed meat, and increase fruit and vegetable servings, that they were able to do these, that they would be able to almost completely eliminate their risk of colon cancer. So one day you'll have a doctor coming to the doctor's office, and it's really not going to be a stick your arm out, let me have some blood. It's going to be, what can I serve you from the food medicine area? So that would be a wonderful way to practice medicine. This study showed that that 35% of all cancers in general are estimated to be attributed to diet, that cancer deaths, that they could be prevented by making the kind of dietary choices you and I have already just now talked about. But you can see that for colorectal cancer, it's twice as many deaths could be prevented, 70%. So when I tell you that there is real benefit that you can give for yourself in your own hands, whatever stage you're at, I really mean it. And I think this can be another guidepost that you can put up when you're really working on making good choices. It is a very significant issue. This is a page from a really interesting book called Anti-Cancer: A New Way of Life, written by the physician David Servin Schreiber, who has come to speak to us at our center. And it's also from the American Institute of Cancer Research, developed this concept called the healthy plate, the healthy diet, and they call it the New American Plate. The average typical Western diet, we all know it. It's a piece of, for dinner, let's say, a piece of protein, which is usually going to be some kind of meat, and then 2 quote-unquote veggies, or maybe 1 veggie and 1 starch. So starch is some kind of potatoes, usually prepared in a high-fat manner, and the other vegetable is probably corn, which is also a starch and not such a great vegetable. But that's a very typical kind of diet that the average Western American eats. And these foods are also highly refined and include lots of hidden fats and lots of hidden sugars. This plate, first of all, you can see it's got a lot of colors on it. The food's very colorful. It's not all brown or white. And that half of the plate is veggies and fruit. There's a small proportion of animal protein, a much smaller portion than we're used to, and you can see there that fish and tofu are the ones that are on the plate, and that there's lots of greens and lots of spices being used in whole grains. So you should try to make your plate start off with half veggies and fruit and then move on from there. That's a good way to execute this. And you want to be having a lot of servings of vegetables and fruits, and you want to have a large variety of colorful vegetables and fruit. And because this gets you a variety of phytochemicals, it gets you a ton of fiber, and all of these things we've already mentioned as being helpful in reducing the risk of colon cancer primarily, and also reducing the risk of recurrence. It makes a lot of sense. If it would have been helpful in the first place, why wouldn't it be helpful now? You also notice that I have more veggies than I have fruit, because we do want to make the balance tip in favor of vegetables. So just to beat this dead horse, increase your fruits and vegetables 7 to 9 servings a day. Decrease saturated fat. How do you know what a saturated fat is? It's solid at room temperature. That's the fat on meat. It's butter. It's cheese. Some of you are going to start crying now, but cheese really is a saturated fat. Increase the use of plant-based proteins, and we can talk about that in more detail in the questions and answers. Try to use organic food where possible, and some choices are better than others. Avoid simple carbohydrates and maintain a healthy weight. Those choices will really help your cancer risk reduction, and also, coincidentally, help with a lot of other chronic diseases like heart disease, stroke, etc. During treatment, there are some specifics that I think you need to attend to a little bit differently with your diet. Eating small, frequent meals so that you spread your calories out through the day, emphasizing foods that are easy to digest, but don't get too many simple carbs if you can avoid it, because you'll gain fat. Eat extra protein and shift your protein earlier to the day. You can use shakes to get extra protein powder into your diet. And also, people are going to start dropping stuff off at your house, and they haven't listened to this lecture like you have, so they don't know that dropping them off brownies, cupcakes, candy, or giant heavy lasagnas with tons of saturated fat in the form of meat or cheese is not as helpful to you. During treatment, something like that, for example, the lasagna, will be difficult for you to break down and assimilate. If your friends ask you for help, be really straightforward. If you know someone who has a good recipe for lentil soup, ask them to make that for you. Tell them you need vegetables steamed for you, and be very straightforward and very directive, and ask them not to bring cookies and candy, but to bring fresh fruit or something else that would be more helpful for you. But this is a place where it's important not to confuse the prevention diet, which we talked about, with high numbers of veggies and stuff like that, with a treatment diet, which is going to really emphasize more protein. Exercise. I'm going to have you guys all think about how much you exercise on most days, and I imagine that some of you are being very happy and very kind of smug about how much you exercise, but many of us struggle to exercise. There are a lot of barriers towards regular exercise in our lives, and some of them are just time and energy and safe place to exercise, not knowing what to do, etc. But one of the major barriers is not being convinced that this is so important. So I'm going to start telling you things that are proved in the medical literature, that exercising 30 minutes most days vis-a-vis colon cancer, not in general, but just for colon cancer, exercise in colon cancer, there's a strong link. If you exercise more, your risk of colon cancer is less. So a lot of you who are having colon cancer are worrying about your families, your children, your cousins, your nieces, your nephews. And so get them on the good, healthy diet and then get them moving. And those are two major interventions that will modify colon cancer risk. So other things, it will decrease the rate of colon cancer incidence, how many people get colon cancer, and it will decrease the risk of recurrence. If you're doing this during treatment, it will increase your quality of life, and it will increase your immune function, and it will decrease the amount of insulin that's secreted by your body, and then how the insulin sensitivity. Insulin indirectly creates inflammation, which helps to promote the development of colon cancer. And finally, this all adds up to a reduction in the making of colon polyps, those little growths in the colon that precede the development of colon cancer by several years at least. So all this helps make your colon cancer less likely to happen. And these things work even better. Exercise works even better for large, complicated polyps, the ones that are more likely to become cancerous. That's kind of a nice coincidence. But even after diagnosis, exercise at about this level of intensity increases disease-free survival interval and increases survival, especially in men, anywhere from stage 1 to stage 3. So it increases death due to colon cancer directly and to overall mortality. And the benefits of exercise increase as the exercise itself increases in duration and intensity. So you have colon cancer. Do I want you to exercise? I am not kidding. I am not kidding. This is really important, and they were done even in colon cancer patients who were relatively advanced. And then the recent data that's most exciting is it improves the response to chemotherapy, improves disease-free survival, improves all-cause mortality, which means dying from cancer or heart disease or something else. So this is one intervention that's largely overlooked because we're often told, oh, sit down, rest, you're going through something. But I really want to turn your thinking around about that, and I want you on your absolute good days to be doing at least 30 minutes a day. And even on your bad days, I want you walking around in your house. I want you riding a bike, either an exercise bike at home or getting on a bike and biking around. Not only does exercise directly improve your survival, as we've discussed, but as Dr. Coscarelli mentioned earlier, it's one of those flexible coping tools you should have. Now, if you have a physical limitation because of a surgery or something like that, okay, don't rip out your stitches to do this. But once you're cleared for exercise, go for it because it's helpful on so many levels. It releases endorphins, makes you feel better, etc. Okay, now we're going to move from sort of those lifestyle things that we're talking about and then transition from moving from diet into other kinds of interventions is this idea of should I eat something or should I take a pill? Should I drink green tea or should I take a pill for green tea? And as more and more foods are being treated like medicines in a way, and they're being concentrated, put into capsules, prepared as medical foods, etc., this line between foods and supplements is getting much less distinct. But here's my sort of basic take on this. I really like people to eat food first. I have patients coming to me all the time saying, how much beta-carotene should I take? And my response always is, how many carrots are you eating? And so you can fill in for that, fish oil, how many fish are you eating? Green tea, how much green tea you're drinking. So you try first with a food. This is important because generally substances that are in foods don't come one at a time. They come in a cluster. So you'll have a lot of different flavonoids, not just the one flavonoid out of green tea, etc. And you want to present these present these chemical substances to the body in the form in which they're used to getting them. And it's also very difficult to become toxic or overdose yourself if you're taking it in food. And that's important too. And so you can see there are a whole bunch of foods that have been used in this way medically. Lots of spices have been used this way, garlic, turmeric, etc. Now, you also have to consider, though, that if the quantity that you need can't be achieved through food, then supplementation it becomes more likely. Also, if a supplement costs a lot of money but a food doesn't, then you can make a difference. So here's an example. If you need a high dose of fish oil, it may be impractical. You may not be able to eat enough fish to get that done. Green tea, the average dose that's been shown to be helpful in studies in Japan are up anywhere from 3 to more like 6, 8, or as much as 10, depending on the outcome, 6-ounce cups of green tea. That's not feasible for most people in a Western culture. So depending on what you needed that for and the amount that we needed it for, we might make a split decision, some to drink and some to take. But that's a discussion. That's one of these incidences of tailoring that I was talking about before. Now, okay. So if you do decide that it's appropriate to get a supplement, and there's some that are quite helpful, always get a good quality supplement. But this is a bit tricky sometimes because you can't always tell. Like the most expensive one is not always the best one. But you can look at the label and make sure the label has all the stuff it's supposed to have. You can know that a company is a good quality company. Sometimes they put quality labels by an independent source on the front of the bottle, etc. You also don't want to take too many. More is not necessarily better. And we want to have exactly what you need and that Goldilocks just right. Try to get advice from a trained professional because your cousin's next door neighbor's sister, although could be a terrific person and great at lots of things, they may not be trained in this either as a medical professional or as a complementary alternative medicine professional, and you do need someone who has some training to help. Generally, I like to have people get formulas that have fewer things in them rather than a jillion things. I'm sure many of you have gone to the health food store, reached out to get a simple vitamin, or even a protein powder. This happened to me the other day, and I just wanted a simple protein powder. And I pulled the thing off the shelf, and first of all, there's some vitamins in it. Okay, fine, I can cope with that. But then there's this long line of 15, 20 other herbs. You'll see this often in specialty products like men's vitamins or women's vitamins. And for me, that just complicates the discussion because what if everything's great, but there's several things in this long list of things that aren't so good for you? And often when you have so many extra ingredients, you may not be getting an actual therapeutic dose of the one you're most interested in. During active treatment, when pills may get to be tough, especially if they're big, something like a calcium tablet that doesn't have a controlled release or a sustained release, those can be cut in half so they get a little bit easier. Supplements that can be taken with food can be tucked inside something like oatmeal or applesauce to get them down. If you're really having difficulty, we often use powdered formulas that can be made and put into a shake, let's say, or there are liquid vitamins that can also be very useful as well. And again, remember, you're going to pick these based on your exact particular situation, and you should disclose this use to your medical team because they need to know, and if they don't know what all these things are, it's a good opportunity to give them some information. If you're using a particular reference, like a book or a website or some other, you saw an article, bring those in with you when you talk about these issues with your doctor, and it can be really helpful. They can really help direct the discussion with your physician very much. Now, when we start to think about foods that can be used to help prevent recurrences, that's what chemoprevention means, preventing recurrences, you can see a whole lot of foods. The active substances inside a whole lot of foods are being used to develop chemopreventative agents. So you can just look through there, and anything that's being looked at to be developed as a chemopreventative agent is likely going to be particularly healthy to be eating as a food. Garlic's a great example. There's tea I showed you coming down the right. Ginger, cruciferous vegetables like broccoli, etc., etc. So these things are maybe developed and turned into pills, but they can certainly be eaten as foods as well. The last big topic I want to talk about is vitamin D, and I'm sure you guys have been hearing a lot about this in the literature, or as you read through your magazines, that you see at the checkout at the grocery store, listen to general health shows on TV. Vitamin D has become a really hot topic. This topic has been developing over the last 5 years, and I'm going to tell you why I think this development is particularly significant for people with either at risk or with colon cancer. Okay, so there is an epidemic of vitamin D deficiency. We've seen this worldwide, that some of these really diseases that we haven't really seen since the 19th century, like rickets, which is a bone disease, a bone malformation disease. I've only seen one of these in my career, and I saw it when I was a medical student in an inner city, very, very poor, malnourished population. I saw it one time. But we're starting to see, and so it was a marker of significant malnutrition and really bad poverty. But we're starting to see it even in developed countries like in Britain, looking at a relatively low level of vitamin D, 32 nanograms per ml. That's what NG means. 90% of the population in England was insufficient. If you're older, if you're stuck in a house and don't get any sun, if you're very, very sick, like, maybe going through chemo or having a big surgery, you're overweight, you're pregnant, or you're on a very restricted diet, or you're a person of color, so you're African American or fairly dark skinned, you're going to be at a higher risk to not have a good vitamin D level because you're either not being exposed to the sun, or you're having additional stressors on you causing you to need more vitamin D. Even over half the patients in an extended care facility run by the VA were deficient at 37 or insufficient at 14%. And we're seeing this more as people are, starting to be really careful about skin cancer prevention, because the sun's not completely benign in this context. You can increase your risk of sun cancer with a lot more sun exposure. So as people are taking in the message to wear sunblocks and protect themselves, then we're all seeing lower doses of vitamin D. And even if you think people are replete, they may not be. So these low levels have been seen even in places like California, Arizona, where we have a fair amount of sun. And in this winter, the organization that's hosting us is in Minneapolis, I believe. And so if you live in a latitude that's very north like that, where you have really dark days, kind of from November through maybe February, you're going to have even less exposure to the sun, so your vitamin D levels are probably going to be lower, and your need for vitamin D is going to be higher during the winter months. But what about this is, and so I think let's see, okay, this is the epidemic of vitamin D that we talked about, why people are at higher risk, then this is the causes. We talked pretty much about those. Vitamin D-rich foods are foods that are generally supplemented. So there's vitamin D added to things like milk, and now orange juice is getting fortified. Lots of other foods are getting fortified. But it's really the cold water fish and things like that, the deep, rich cold water fish, cod, salmon, etc., that have relatively high vitamin D levels. A serving of milk really still only has about 100 international units of vitamin D. It's really almost impossible to get your vitamin D needs met through food. This is one of those times when I would come down on the side of supplementation, because I didn't want you to be taking everything from the sun, but I did want you to get a very robust level. The next picture shows you kind of where vitamin D comes from up the top. There's like the sun and milk and things like that. And then this picture is not that easy to see all the details, but what I wanted to use it to describe to you is the fact that not only does vitamin D help protect bones, which we know about, but it also has direct anti-cancer activities as well. And these activities can be very significant. And, we've actually have lots of studies that are showing that people who get diagnosed with a cancer usually have lower vitamin D levels, and often the worse that their cancer is, the lower their vitamin D levels. So, for example, in a study that looked at a group about 500 stage 4 cancer patients, 50% of them were frankly vitamin D deficient, less than 20 nanograms per ml. Less than 20 nanograms per ml. That's a very low level. And if you're under 10, which some of our patients have been, we really think that then you're at risk for a disease like rickets again. And that's why we're starting to see this even in well-developed countries. So 50% deficient, 32% insufficient, which is up to a level of 30 nanograms per ml. So that's 82% of stage 4 colon cancers have very low vitamin D levels. So we do think that this is important, and there's lots of studies that have been done on things that this little picture shows you, how vitamin D reduces the risk of development of colon cancer. But even after diagnosis, higher levels of vitamin D after diagnosis are associated with higher survival from colon cancer, and you can decrease your risk anywhere from 20 to 80%, very statistically significant, and increase survival overall, although at a lower amount, somewhere between 15 and 60%. So vitamin D is a very important thing to find out about. You need to know your vitamin D status. You need to discuss it with your doctor directly, and I'll tell you later on what I think your vitamin D level should be. There's early data developing now that's really exciting that increasing your vitamin D level may increase your responsiveness to conventional chemotherapy. And if that's true, it's really excellent because it'll give us another way to improve efficacy to treatment even while we're working on all the other lifestyle issues. So there's my next slide. So this is from a very interesting paper presented by a vitamin D expert, and he said that if we had got everybody up to that, 35 nanograms per ml, you can see the dotted line hitting this little dark line. This means that if we got 50%, if we got people up to this level, 35 nanograms per ml, it would reduce half the colon cancer risk in the country. Just that one simple thing. So this is the kind of thing that you also would want to talk to your family about, because with your development of colon cancer, your family is at risk as well. So they should find out what their vitamin D level is and optimize it while they're working on diet and exercise and the other lifestyle interventions. We already talked about good sources of vitamin D, and even all these sources are probably not going to be sufficient. If you have a very low vitamin D, you might need a prescription, but there also are good quality over-the-counter supplements that you can use as well. So this is another time where supplementation and maybe even prescription would be recommended. There's two different kinds of vitamin D that are generally available in the market. Vitamin D2, which is in the prescription version of vitamin D, and vitamin D3, which is the type that's usually in over-the-counter supplements. Which one is better? It kind of depends. Vitamin D2 comes from plants, and vitamin D3 comes from more like animal sources. So vitamin D2 has to be converted to be turned into the active form of vitamin D, and that conversion is inefficient. So you only convert about 2/3 of vitamin D while you convert all of vitamin D3. So usually you need a higher dose of vitamin D2 to get the same effect, but it's very effective at raising vitamin D level in the blood. So both work. You just have to know this little trick about you convert less vitamin D2 than D3. So basically, I think it doesn't matter. It's a matter of what's convenient and what's best to take. A supplement you'll have to take every day. The prescription vitamin D can be given once a week, once a month, or even sometimes every 3 months or a year. I feel very comfortable with every week. I'm a little bit less comfortable with every month, although the medical literature shows that these both work. The literature that was done looking at a giant dose of vitamin D once a year actually showed that the dose, I think it was 100,000 units or something really high, maybe more than that. But it was actually, I think it was actually harmful. So we really recommend that you either do something daily, which is a supplement that you can over-the-counter supplement, or a weekly prescribed pill, or at the very furthest out, a monthly prescribed pill. But weekly or daily usually works the best. You're not going to be able to read what's inside that little pink box, but this is the Institute of Medicine Dietary report that just came out in 2010 and raised a big ruckus because the level of vitamin D that they recommended was quite low, and it was on the order of not even 800 international units. This study was done specifically looking at the levels of vitamin D and calcium, which would protect bone. And I think these levels are definitely too low for cancer patients. Now, the actual dose of vitamin D you need is difficult to say because there's so many variables. What form is it in? How well is it absorbed? Do you have genetic issues that make it easier or harder for you to use vitamin D, etc.? So clearly, we can't specify a dose, but the Institute of Medicine clearly said that there's no significant harmful effects for a dose of up to 10,000 international units a day. But taking a safe, conservative approach, most people feel that starting around 2,000 international units is reasonable. I think it's better to check your vitamin D level and then dose what you need to get your vitamin D level to 50 nanograms per ml or higher. Now, also calcium, which is frequently given with vitamin D to protect bone, turns out to also be very useful for reducing colon cancer risk and reducing the formation of colorectal adenomas. So that should be around 1,200 international units. How to find reliable information? You should be a little bit suspicious of things if you don't know the source. Sometimes things on the Internet can have hidden advertising or hidden distortions. If you go ask somebody in the health food store, they will tell you what to do, and they're likely not going to be the most skilled person to make those recommendations. Find a good health expert, even your family and friends who you love. Just really, that's your lay medical expert, but they may or may not be on the right page here, so you need to check it out with someone who does have a little bit of training. Thinking about other complementary alternative therapies like acupuncture and chiropractic or different kinds of massage or whatever, generally these therapies are very safe if done well and done properly. Even something like acupuncture, which is great for nausea, fatigue, etc., does have some limitations. But if you're a knowledgeable person, they're actually less than you might expect. So if you're on a blood thinner, you really discourage using acupuncture, but if it's necessary, there are ways you can modify the treatment so that you can use it safely. So you want to be sure that you find someone you can work with who's well-credentialed, you've gotten a strong referral from, and just like with conventional medicine, if this person answers you well and talks with you and answers your questions, that's a much better sign than somebody who doesn't speak your language or doesn't answer your questions. This brings up my red flags for complementary alternative medicine therapies. If something's too good to be true, it often is. So when you see somebody telling you this will cure you and it's not toxic and all you have to do is take fill in the blank, really be very, that's an extraordinary claim. It requires extraordinary proof. If someone's overpromising, you should be a little bit reluctant to believe them. If there's secret ingredients that they won't disclose, if it's very expensive, that makes me a little suspicious. If they're not willing to talk to me about what they're doing or any other medical person, if all they'll tell you is stories and they have no statistics, if it never hurts you, it only is powerfully helpful, that doesn't make sense to me. And if they're very negative about the medical system and very dismissive of the medical system, I don't want a doctor who will be dismissive of good complementary care, so why would I want a complementary practitioner who would be dismissive of the medical system? So this tells you a little bit about how infrequently these traditional treatments have problems. And the one thing I will say is massage has not been shown to affect cancer spread. But if you do have lymphedema, either after surgery or after radiation surgery, you should have someone, don't have a regular massage therapist work on that area, and that should only be handled by someone who's trained in lymphatic massage. So we're very grateful to have had this time with you tonight, and you can see from the picture we have up now that our center is robust with lots of different ways to serve and help. And we hope that you've gotten a sense of what those things are. And please come to our website, which I think you've probably seen already, the URL, and let us continue to be in dialogue with you about all these wonderful things. So the next slide is always Anne's slide, so I'm going to ask her to do the next slide.
I've been in this field for 30 years now, and I've always had three wishes. And the first wish is that colon cancer could be prevented. And my second wish, and I'm not sure that I'll see that in my lifetime, I wish that colon cancer could be cured for absolutely everyone. And I'm not sure that I'm going to see that in my lifetime, but I really do believe that colon cancer patients and their families can receive optimal integrated medical, psychosocial, spiritual care throughout the continuum of their care and journey. And that's something that's doable right now, and I encourage you all to find the resources to really get that for yourselves.
We would also like to thank the Sims Mann Family Foundation, and our two major donors are there on your field, Vicki and Ron Sims, for their continued support. They've been supporting this work of the Center for over 15 years, and without their support, we couldn't be here today talking with you. So we both thank you very much for your attention, and I miss not being able to see you while I'm talking, but I'm hoping you'll ask a lot of questions. So Donna, back to you.
Okay. We will now begin the question and answer part of the webinar. As a reminder, participants who have logged on to the webinar can submit questions for the speakers by typing their question in the box titled Ask a Question. Participants who have called into the webinar can submit questions for speakers by pressing star, then 1 on your touch-tone phone. To withdraw your question, please press star, then 2. Due to time constraints, we may not be able to address all the questions submitted, and I'll read each question aloud and then provide time for the speakers to answer. I realize we're a little bit longer from the presentations, but I feel this is a very important topic, and we have many questions to get through, so I want to take that extra time, and I hope that you will stay with us through these question and answer part of the webinar. I'm going to begin with the first question. Are there supplements to help with the neuropathy left in my feet from treatments 5 years ago?
Okay, Anne, that one's for you.
Yeah, I don't think so. I think it's your question. Okay. I've heard you answer that many times.
Yeah.
Go.
I think there are things that can be helpful. I often use glutamine. I will frequently use alpha-lipoic acid. And the doses and the amounts and when to use what would depend on several things. One, if someone had an existing neuropathic condition before they started treatment, and then if make sure there was nothing like nerve entrapped or out of control blood sugar and stuff like that. But if everything else was not, if there was no other cause, then I think you could try some glutamine and some alpha-lipoic acid, and talk to your practitioner about what would be the appropriate doses for you.
Okay, the next question. I don't want to take sleeping aids, but I find I have insomnia every night. Any suggestions?
Now, Anne, that one you can definitely do.
Yes. I really think that you probably need some additional help. One question is, do you need to have your sleep disorder worked up in terms of, potentially talking to your doctor about it? Or more importantly, there's a strong body of research suggesting that cognitive behavioral therapies actually help with sleep disorders. So what I would encourage you is to get yourself to some kind of a psychologist who's trained in CBT around sleep disorders, because there's a whole system that they will do that can help you to develop a plan for dealing with your insomnia. And it does often require getting off the medications, and sometimes you can have some difficult nights initially, but then you'll get to the place where you may be able to sleep without those sorts of sleep aids. But some of the components of it are some of the things that I already articulated in terms of, part of it's dealing with the anxiety that you have around not being able to sleep. And that's a really significant problem when people have ongoing sleep difficulties. And there are a number of people who really specialize in this area. But then it's also some of the sleep hygiene kinds of things that I talked about in terms of having that regular bedtime and wake-up time and not sleeping during the day and using your bedroom only for sleep. not watching television, taking your computer, your cell phone, those sorts of things. So really avoiding those kinds of stimulating activities.
The other thing I'll add to this is sometimes people who have a lot of trouble sleeping, when they lie down at bed at night and shut off the light, it's the first time they've been really quiet the whole day, and they've been really using distraction to manage their anxiety. So if you find that you're thinking of a million things, then I would really suggest either writing some lists, doing some journaling, starting some of the other mind-body things that Dr. Coscarelli talked about. There are, and the sleep hygiene is really critical. There are some supplements that can be useful, but it depends a lot on exactly how your sleep is disordered. And one thing, for example, you could try is melatonin, which, because it has not only does it have good effects on helping you sleep, but it also has been shown to reduce side effects of some of the common agents used as chemotherapy for colon cancer patients. Test with a low dose first, like around 1 to 3 milligrams, because about 10% of people have a paradoxical response to melatonin. They find it stimulating. So if you don't have that reaction, then that's another thing you can use to aid you to sleep after you've done your mind-body work.
Okay, our next question. What is the best exercise during treatment?
I actually think walking. It's easy to do. It's freely available. You can take yourself or have someone take you to someplace nice. You can walk inside your house. You can walk inside the mall. And it's really straightforward. And you can pace yourself so that you walk at a pace that's really that gives you a little bit of, you're stretching a little bit, but you don't want to really overdo your exercise. That being said, pretty much any other aerobic exercise, dancing, that's kind of fun. Turn on the radio and dance for 10 minutes. That's often a nice one. And there's really no excuse not to do that. I always like to dance to like the Supremes or something, myself personally. You can also bike. You can swim, although you have to be careful about ports and open wounds. Rollerblade, we rollerblade on the beach here a lot, but they don't want you to fall. But so pretty much the simplest thing is just to walk. Don't try jogging or running or anything. Just walk. That's a great place to start.
Okay, the next question. How do you determine whether to use soy or not? I see it is healthy and recommended, but doesn't it also lead your body to produce estrogen? Is there something in its place you would recommend for, say, protein drinks?
I think soy as a plant-based protein, it's a very good quality plant-based protein. And you heard me talk earlier about how reducing meat consumption, especially red meat consumption, to 1 serving or less per week, and red meat includes beef, pork, lamb, and veal, then you're going to be looking at really high-quality plant proteins like soy. Soy does not cause your body to produce estrogen. There's actually a component in soy that's called a phytoestrogen, and that's a component where the structure of this chemically resembles estrogen, but it doesn't turn on the estrogen receptor. It, in fact, blocks the estrogen receptor. So I think actually soy is a decent food to eat as long as it's a whole soy food, as long as it's edamame, tofu, soy milk, miso, etc.
Okay, the next question. In addition to the integrative plan components you presented, would you consider acupuncture and other treatments?
Yes, I would. I think those are very good for managing nausea, fatigue, digestive difficulty. Acupuncture is one component of traditional Chinese medicine, and as long as your platelets aren't really low, there's really very few limitations on acupuncture. If your platelets are low, then the practitioner has to be very careful about point selection, etc. But most well-trained people will know how to do that. And if your white count is low, they have to be really meticulous about their sterile technique, their aseptic technique. Really clean the skin off. And acupuncture should always use disposable needles. You should never be treated in this country by a reused needle. Now, Chinese medicinal herbs are a lot more complicated, and that really should be evaluated by somebody who understands the medical system and understands the herbs so that they really don't create the potential for herb-drug interactions.
Okay, the next question. I would really like to try visualization and meditation, but I'm having a hard time finding a place to learn this. Do you have any suggestions for where I can go to learn visualization and meditation techniques?
You know, there's often a variety of places that will teach these, specifically for individuals who have cancer. It's not unusual to find them at local hospitals. American Cancer Society programs often have workshops that they do on these. So I would look in your local communities in anything that's sort of cancer-based to see if they have any of those. But it can be as simple as actually going on the web, and if you simply type in guided imagery into your browser, you'll actually find that on YouTube there are a number of actual visualizations that you can look at, and they have someone who talks in a very relaxing voice, and you can kind of choose the metaphor or the visual idea that is appealing to you, whether that's a sunset or a beach or a mountain or the sound of water. So if you really want sort of more someone to talk you through that with that, and with that visualization, you can even do that in front of your own computer, and it doesn't cost anything. So I think there's a variety of techniques. We frequently do them here in the center in group programs. And also it's not unusual for either, you know, in hospitals where they have chaplains or social workers, and you might be in treatment. Some of them know those kinds of techniques and are more than willing to teach them individually to patients as well. So there's a variety of ways that you can learn it, and I think that it's actually quite accessible these days.
And I'll just add that there's also great apps on your iPhone, iPad, or Android phone, and you can also even just, while you're doing this visualization and someone's talking you through it, put up the beautiful picture of what you're trying to visualize, and that's also very helpful.
Next question. Is it necessary to take vitamin D together with calcium?
We generally give them together because vitamin D improves the absorption of calcium. But you usually have to take calcium 2 times a day, and you don't have to take vitamin D 2 times a day. You can't absorb more than 600 milligrams of calcium at a time, so you need more calcium than that, so you're going to have to take it in at least 2 doses. So it doesn't have to be together, but I usually try to have at least one of the doses be together, vitamin D together with calcium. The other thing about vitamin D is it's fat soluble. So if people are also taking fish oil, or I have them take the vitamin D together with that to improve the absorption.
Okay, we have several questions related to nutrition and diet, and several related to the causes with diarrhea. I'm going to try to get through some of these and see if I can group some together for the speakers. For example, one of them is, if I'm struggling with diarrhea from chemo, I can't eat vegetables and fruits. I can only eat white rice, white toast. What can I do?
Well, I think that there are, I think some vegetables and fruits would be less harmful. You could have bananas, for example. Those tend to be part of the brat diet, the diet to have when you're worried about diarrhea. You could replete your electrolytes that you would be losing with dilute fruit juices, therefore getting some of the constituents from fruit, although I don't recommend generally drinking a lot of fruit juice. The final issue is just really to try to get your diarrhea under control, so therefore you can go back to eating more normally. In a really dire situation where it's part of the side effect of a medication, let's say, and you're really struggling to get it under control, this is one of the places where I would encourage people to think about a green drink of some kind, and that's a very complicated topic that you should discuss with somebody that knows what they're talking about. If you're going to get a veggie juice, let's say, prepared commercially, double check that it doesn't have a lot of sugar put in it. So if you take a green type drink off the shelf and it has more sugar than orange juice, you should be cautious about how you use that.
Okay, here's another similar type question. What can I eat to slow down my bowel movements? I go 15 times a day and my bottom is sore.
Oh, poor you. That's a tough situation to be in. It depends a lot about why you're having so much diarrhea. Some causes of diarrhea can be related to inadequate probiotics in the gut, good bacteria. So I often encourage my patients to be eating yogurt continually so they're getting some good probiotics. But you might also try taking extra probiotics. Sometimes apples or bananas, apples, rice, and toast, that's the brat diet, which is often given to people with diarrhea. Apples generally have a lot of pectin in them, and pectin can slow things down. Again, depending on the reason why you have diarrhea, oddly enough, fiber may sometimes slow diarrhea because it actually bulks up the stool and allows you to help form it. But the causes for this are just everything from you have a high colostomy, you have an infection in your gut, the medication's doing it, etc. It's really something you have to figure out exactly why and then struggle with what to do to protect that. In terms of your poor sore bottom, I would do what we call sitz baths, sitting in your new best friend should be somebody that has a whirlpool tub, so you can sit in the whirlpool tub and maybe have a little bit of Epsom salts in the water, and then put on a cream, something like calendula, on the outside that can be soothing and help protect that area, because you really don't want that skin to break down. Make sure someone's taking a look at it for you frequently so the skin doesn't start to break down.
And I'd also just like to add to that, because I've had some patients in these circumstances, and I've seen sometimes that they really get better when they're appropriately evaluated, and it's sometimes getting a second opinion about what's going on, because these things can come from multiple causes. Finding a GI doctor, potentially in an academic environment where they may have either newer medications or ideas about how to treat this, really encourage people to get another opinion and potentially a GI doctor who's really up to date in what's going on and can evaluate it so that you have a good idea about it.
Right, and that's why Anne's really emphasizing the first thing I said, which was that make sure you have the right diagnosis. Just because some of your chemo sometimes causes diarrhea doesn't mean it's the cause of your diarrhea now.
Okay, here's another question related to diet. I tried eating mostly egg and fruits, and I lost 18 pounds in 3 months. They don't want me to lose any more weight, so I stopped eating this way. So should I continue to eat this way and risk losing more weight?
No, absolutely not. And I don't think eggs and fruit are an adequate diet.
I think it's meant to be vegetables and fruits.
Oh, thank you.
Okay. Yeah, the thing about vegetables and fruit that make them so great in the prevention diet is that they don't have a lot of calorie density, and they have lots of good phytochemicals. So this is a classic example of confusing the prevention diet with the treatment diet, right? So basically, you need to be eating enough protein, eating enough bulk, and getting enough calories. And it's going to probably require you working with a nutritionist who can help you do that with healthy food as opposed to just, the classic just eat all the ice cream you want kind of thing. There are ways to put weight on in a healthy way, but it's going to require some attention. If you're really stuck with just for the first go-around, just getting those canned or bottled drinks from the store, like the medical ones, a couple of brand names that you might recognize are Ensure or Boost, then you should get the one that's called Glucose Control or Extra Protein or something like that, and you can at very least start adding some of those into your diet.
Okay. The next question is, do you have any recommendations for patients that have a colostomy bag? I had to give up my healthy diet.
Yeah. Again, that's what I said. It's a little bit more difficult depending, but my patients, and this is where, remember I told you my patients were my best teachers. I've had patients be able to tell me that if they take a certain amount and kinds of fiber or use a little bit of things that slow their digestive motility in their gut, they can end up controlling to a degree what comes out in their colostomy bag. If you're having a lot of gas and stuff, I'd really think you ought to have your digestion evaluated. I would certainly make sure you had enough probiotics and good bacteria and good right foods for them to eat. And I would not discourage you from eating fresh foods, just to try to get your stool more regulated.
Okay, here's another one. I remember how incredibly difficult it was to find anything to eat that I could actually keep down. Once I found something I could tolerate while in treatment, within 2 weeks that same thing would make me so sick. Is it more realistic to say that eating healthy is even more important, actually doable after treatment for preventative purposes?
Certainly, if you're really struggling with your treatment, I would first have you, again, like Dr. Coscarelli said, make sure you talk to someone. You'll get a second opinion, because a large number of these conventional therapies can be quite well. A lot of symptoms can be managed well in the conventional treatment. You might think about adding something like the acupuncture to help with treatment, very especially for nausea. And I do think that if you have your absolute favorite food, you might want to reserve it for after treatment, because you will maybe not be able to eat what you ate a lot during treatment for a while. The best thing to do in that case is, in the case of sort of persistent symptoms, is frequent small meals, protein with every meal, small amounts of continuous protein, and really that actually helps a lot with nausea and energy and fatigue too.
Is drinking green tea cold the same as drinking it hot?
It probably is, as long as you initially make it hot, and then obviously if you cool it, you're going to dilute it. But the main problem with green tea is that if it's left standing, it's a lot, you lose some of the flavonoids, some of the good compounds. You can't make a giant bucket of tea and then drink it for the next 3 days and have equivalent results.
Should we do colon cleanses?
No. I could elaborate on that, but I really think it's a bad idea in people who've had surgery, et cetera, and then you wash away a lot of good stuff. But if you end up having a leak or a rupture, it's horrible. It's just it's really, really bad.
Okay. I have heard that an alkaline diet can be helpful to maintain a terrain that is not conducive to allowing cancer to thrive. Do water ionizers or water systems that claim to change alkalinity of the water really do any good?
I have to say that I haven't seen a lot of evidence in this regard, but I do think that I do think that eating a diet where the end products break down into alkaline end products, such as mostly vegetables and fruit, again, often in the largest sense of the word, but it's very difficult, if not impossible, to end up to really actually do that. Be able to do that with your diet. So you can't. It's very difficult to end up basically really changing the pH of your body. Almost impossible.
Okay.
Okay.
I get the worst scanxiety between the scan and getting the results. Any ideas?
This is a really, really common problem for people, and that's some of what we were talking about, some of that anticipatory fear of recurrence and some of that post-trauma that comes along with this. And it's a difficult thing to manage, because I think that there's, some realistic concern, and it brings it kind of front and center for you. But so one way, remember we talked about, rather than controlling things, but how do you manage it? So I like to think about what are the management plans that you can put in place. And one of the things that I can't counsel people about is to try to arrange their scans and their time when they're going to get the results in their scans as close together as possible. So I wouldn't have a scan, if you can avoid it, on a Thursday or a Friday where you may not get the result. You're going to go all weekend long. So I often encourage people to see if they can get their scans done on Monday, how quickly those results can get done, and then arrange to have a follow-up appointment with your doctor, whatever that earliest appointment, and really plan those things. So that helps to sort of reduce the amount of time. I think it's all about how much time, we're in these higher anxiety states. So that's one way, is to try to control the timing. The other thing that I think is really important is to be able to use those, sort of cognitive coping strategies to reframe the experience, and to remember that just because you've had a scan, it doesn't mean that you're going to get negative results. And being able to develop a set of statements for yourself that are somewhat comforting. That your last scan was a good scan. You have no reason to believe that there's going to be a different result. Just being able to say that in your head, or developing some other way to kind of reframe what's happening. I don't have cancer until I've been told that I have cancer. That's another one that can be really helpful, which keeps you more in the present. So again, it's trying to keep yourself in the present, not worrying about the future, and then also reminding yourself that whatever the results are, that you're going to have the tools and skills to be able to manage whatever those results are. And then I think this is a place where distraction techniques can be particularly helpful. So making sure that you're busy and you have other things to do during those periods of time when you're waiting for those scan results, so that you're not just sitting by the telephone waiting and feeling completely overwhelmed. Have someone get social support, people that you can talk to about the fact that this is an anxiety-producing time for you. Make sure you plan some activities with those people. So I think it's sort of like you have to develop a whole management strategy, but I think that in the management strategy you can find that you can lower the anxiety through it.
What do you think about taking baby aspirin to prevent recurrence?
Aspirin is a COX-2 inhibitor, which reduces inflammation. COX-1 and COX-2 inhibitor, actually. The problem with aspirin is that there's a significant risk of increased bleeding. So that discussion of whether to take this, even though it's an over-the-counter product, it's still actually a drug with some benefits and some significant risks. So there's some data to suggest that could be really helpful, but you should talk with your doctor. Some of the plants that I showed you, curcumin, for example, from turmeric, etc., fish oil, these are anti-inflammatories in their own right, and some of the reason why they're included in a healthy diet are to actually improve, to decrease inflammation. So that's a good question to ask your primary, but I think it's a really reasonable thing to pursue if you can actually take aspirin. Take it as an enteric-coated product so it doesn't irritate your stomach.
Many people have leg cramps during or after treatment, and the oncologists just blow us off. Ideas on causes or cures?
Leg cramps are pretty common for a lot of people. One of the easiest things to help with restless leg or leg cramp is actually to walk some before you go to bed, back to that exercise. But that can actually kind of exhaust your muscles a little bit. Sometimes they're the result of imbalances in minerals, and then I would take calcium and magnesium. If you've already exceeded your calcium dose for the day, take one of your doses you take during the day, take it at night. You can even add extra magnesium as long as you're not having really loose stools. So those are the first few places I go. Keep your legs warm, keep your feet warm, stuff like that.
I have found that some of the skills you mentioned seem to work well for transient pain, but not so much so for chronic pain. Do you have any suggestions for chronic pain?
I'm sorry, I missed that. Could you repeat that?
Sure. I have found that some of the skills that you mentioned during the presentation work well for transient pain, but not so much for chronic pain. Do you have any suggestions on how to deal with the chronic pain?
It's interesting because there's a lot of research that suggests that the kinds of skills that I talked about, particularly some of the mindfulness approaches, are particularly helpful with chronic pain, not just transient pain. And so I might think about revisiting some of these. Some of the work that's been done by Jon Kabat-Zinn, and he's written a number of books, Full Catastrophe Living is an example. They really originated out of work that was being done with people who had really chronic, debilitating pain. And it taught people about how one goes about living with that pain and how that can be altered and changed by the way in which they approached their life. So I would really think about revisiting it, and maybe it might be that one technique might not be as helpful for it, but I would really consider moving into sort of the mindfulness approach and looking into that. If you haven't done like maybe one of these sort of 8-week programs in mindfulness, I might think about doing a much more rigorous program in it to see if that might be helpful in dealing with the pain. Now, that being said, I'm also going to say that sometimes I think it's important to get your pain evaluated. What is that pain coming from? And a couple of suggestions would be, there's more and more survivorship centers of excellence around the country. UCLA certainly has one, and there's often an emphasis on trying to look at some of these sort of secondary kinds of ongoing problems that patients who have had cancer are living with. And so there's often a workup associated with that. And sometimes actually seeing a pain management specialist may be another important piece of this. Someone, just as we go to an oncologist for the treatment of our cancer, sometimes going to someone who is a real specialist in pain management might be appropriate as well. So I would look for, a combination of these programs. And again, I think Dr. Hardy mentioned acupuncture. Acupuncture can sometimes be helpful for pain as well. So some of those techniques might be utilized. And sometimes it's not always about an individual technique, but the combination of them, such that each technique or each approach that you take might help to shave a few percentage points off the degree of pain that or struggle or discomfort that you're having, and when combined actually can improve the quality of your life. It might not make the pain completely go away, but it may move you to a place where the quality of your life is better and you're able to live in a more functional way and enjoy more things in your life.
Is there a list of bogus supplements or a watchdog site like the Environmental Working Group you could point us to which would help us steer clear of useless or harmful products?
The Environmental Working Group that the questioner mentioned is a great place to go get information about what produce should be organic and what produce may not have to be organic. So I encourage you to follow that website up. When you're talking about some of this stuff, it gets difficult because it depends on whether you have my exposure to the literature. So some people may say that something's useless, and I have 15 studies that say that it's helpful. So you can certainly go to one of the Quackbuster sites and find out that all this stuff is not useful. But in terms of a real rational, balanced site, I actually, off the top of my head, don't have a great single place to send you. Unfortunately, I'm really sorry. Quality of supplements, you can sometimes get information at consumerlabs.com, but that just means does the label reflect what's really in the bottle. So I'm really sorry that's not, I can't be more specific.
Okay, we have someone here who's asking a question. They take 9 different types of supplements, multiple capsules of those supplements, along with their regular scheduled cycle of Xylota. And on days when they're asking the question, on days when I just can't get all that down in a day, what should absolutely stay and what could go? Sometimes I feel like my life is all about getting this all down, and I feel like I've failed if I don't make it. I could provide the list if necessary, but I didn't know.
Yeah. I first of all, before we even start talking about the particulars, I've often seen that people who take a lot of supplements, I always want to ask them, are you managing an actual supplement issue, or are you managing anxiety? Control and trying to sort of really, over control something. And I think that's a really interesting place to start, to be honest. So if that's the case, then, do what Dr. Coscarelli was talking about and then evaluate what you think is good. So, and some of these supplements have multiple doses per per thing. So I really always start with people, and my like I said, more is not always more. So I always look and say, why are we taking this? Is it in the most effective form? Is it in the best form? Might it be better to take it in a more concentrated form to reduce the pills, etc.? And on days when you absolutely can't get all that down, then you would pick the things first that directly help mitigate the treatment so that you can continue to take your treatment. And things that are more about long-term prevention, you would probably put next, or mid to long-term prevention. And then things that have a non-cancer-related function, like calcium, which is for bone health, and adenoma formation, but that's a ways away in the middle of active treatment. Those things are the ones you kind of let slide on the days when you just can't do it. We also ask people to try to get things maybe as liquids, or if you're taking a shake, to get things in ways that you can bundle some of your things together. So.
Someone asked, I'm done with treatment. What is an acceptable amount of wine to have in a week?
Again, this is a place where I don't think daily drinking is useful for someone who's trying to put a cancer diagnosis behind them. Certainly if we're looking at heart disease prevention, it's 2 drinks a day for men, 1 drink a day for women. And I don't think anything more than that has any basis in health, and in fact actually has data that suggests long-term harm. Now, this doesn't mean if you go out to a real fancy dinner or at someone's wedding, you don't have a couple or 3 glasses or whatever, but it means that you don't regularly have those, So that's the most important.
Okay, we still have some more questions, but I'm keeping my eye on the time, and I see that it's almost approaching 2 hours. So those of you that have submitted questions that we were unable to answer, I will work with the speakers to try to get your questions answered, or the patient support staff at the Colon Cancer Alliance will try to also answer your questions. And if you have any questions, additional questions, you can always submit them by sending us an email at the Colon Cancer Alliance or calling our helpline. So on behalf of the Colon Cancer Alliance, I would like to thank our speakers, Dr. Ann Coscarelli and Dr. Mary Hardy from the Sims-Mann UCLA Center for Integrative Oncology, for their participation in this webinar. I hope as a participant you leave this webinar tonight with the information you were seeking. Shortly, you will receive an email from the Colon Cancer Alliance asking you to participate in an online survey. The Colon Cancer Alliance values your opinion, and we would like to hear what you have to say about this webinar. As a thank you for participating in the survey, you'll be entered into a drawing to win one of 2 $10 Target gift cards. Thank you, and good night.
Good night.